Common question I get asked is my child with ADHD on the spectrum? And there is sometimes a confusion between ADHD and ASD or autistic spectrum disorder. You know, it's a bit of a cliche when somebody kind of says, are you on the spectrum? And in a way, it's a bit of a hurtful thing to say to parents whose child has autism or autistic spectrum disorder. So I'd like to just clear up a couple of things between ADHD and ASD. A child with ASD has a particular set of behaviors, and they can look a lot like ADHD. And if we have a look at the concept of Asperger's syndrome, these can kind of very much mimic ADHD. The term Asperger's, I'm afraid, doesn't really exist anymore, although it's used and people know what you're talking about. In 2013, the diagnostic manual that everybody uses to classify mental conditions did away with the term Asperger's, and it's been included in ASD, autistic spectrum disorder. It's a spectrum of problems. Asperger's is reserved for those children that are what we call very high functioning. In other words, have very mild symptoms of autism. So it can be, I think, for some parents whose child is high functioning and has very mild symptoms, it can be, they feel it's a bit of a stigma, being called, or their child being called autistic. So I think what we should do is try and clear up some of these kind of concepts, and there can often be a misdiagnosis of ADHD in autism. The smarter the child, the more intelligent the child. Often these can be delayed, and they say that there is a long delay in children. The brighter they are, and of course the more subtle the symptoms. Almost 80% of all children with ASD, autistic spectrum disorder, also satisfy the criteria for ADHD. So you can see why there's going to be a lot of overlap and confusion. What actually causes autism? The honest truth is we don't know. But one thing I can tell you, it's not due to vaccination, and it's not due to MMR or measles, mumps, and German measles. I've done some research lately, and there are those, you get onto the internet, they think it's due to diet. It's genetic. There definitely is a genetic component. And autistic spectrum disorder is also a problem of the executive functions of the brain, right here beneath the forehead, in those executive functions. And it's where the same problems with ADHD, but it's not ADHD. It is a completely separate condition. So, what is ADHD on the spectrum? There are many characteristics of ADHD in ASD, but they certainly are not the same things. Children with ASD have social awkwardness, the ability to focus on a few very interested things, very narrow spectrum of interests, almost like an obsessional interest in certain things. And then, of course, impulsivity. And, I had a patient, this is going back a couple of years, where, this is a child who came to see me and had been on some medication by their general practitioner and been treated for ADHD. And they had not been that successful. And one of the things we find is children with ASD often are put onto medication for ADHD, and the medication doesn't seem to be that effective. It doesn't seem to treat those symptoms, because somehow the treatment for ADHD medications doesn't seem to work that well for ASD. And of course, there's so many other interventions that are important. But, when you have a child who kind of has difficulty interacting socially, particularly when a child gets older, goes to school. Children with ADHD can also have social awkwardness. They tend to sort of annoy, they hack off everybody, they tend to be too much. Children with ADHD often are quite social. They talk, they can't help but interacting, they disrupt. Often children with ADHD have a lot of difficulty interacting with other children. They don't get those social cues. They don't really understand the politics of life as well. And of course, so they have often a speech-related problem early on, but sometimes children that are high functioning don't have those problems. That's why they get confused with ADHD. And then there are also the social issues, not really picking up social cues. I remember a child saying in my conversation to them, and this child turned to their parents and said, Dad, am I being appropriate? And I thought that was such a classic remark. In other words, they don't know. They've got to learn. They've got to learn what is normal socially. How do you interact? They almost look at people as special objects. And then, of course, there is this narrow behavior that everybody knows about, this obsession with certain objects, certain kind of obsessed with a particular interest, whether there's dinosaurs or science fiction or a particular obsession. I had a child who was completely and utterly obsessed with Bob the Builder. There was a child who was absolutely obsessed about Thomas the Tank Engine. And literally the only thing they would talk about is Thomas the Tank. So what happened to Asperger's syndrome? In 1944, there was somebody who described this called Hans Asperger's, who first described it. And he described people with strong vocabulary and language skills, had distinct use of language, certain kind of funny tone in their voice, were socially isolated from their peers, performed these repetitive behaviors, and had very strong interests. And these children, like we find, prefer structure. They like predictability. They literally kind of freak out if they are out of their order and out of their kind of routine. They don't like transitions, very much unlike ADHD. So there you see the kind of the difference. And there is such a spectrum like ADHD. There are many different types. So, what I would say is, what do we actually kind of look for in a child to qualify for Asperger's syndrome? It's got to be diagnosed by somebody who understands these things. Asperger's kind of checklist, there are three major categories, and there's the communication impairment. Speech development can be within the normal range, somewhat delayed. Difficulty arises in the functional, social use of this language and communication. Impaired use of non-verbal, eye contact, body language, social expressions, almost kind of a blunted. Often I find, even younger children, which I'm going to make another video about how to detect children when they're very young. You watch these children in my room interacting. I've got little toys I give them. And they almost use this toy as a sort of like an object. If it's like a little teddy bear, they don't hug it and kiss it. And sort of, they use it as kind of like a weapon or some sort of kind of banging instrument. They don't make eye contact with their parents. They don't want social reciprocity. They don't make this contact. They have difficulty. They live in a world of their own. And then, of course, the social interaction, poor social interaction isolates them, makes them anxious. They often have sensory problems, the sensory processing disorders. They tend to get freaked out by lots of stimuli, or they can be sensory seeking. Children, often they're moving themselves, they can scratch themselves, they kind of bang their head to get like stimulation. And if they can't move, then they're moving themselves, they flap their hands. And they have these funny stigma of mannerisms. They seek out others to enjoy their interest, but, they have a difficulty doing that. And, of course, they lack that emotional, social reciprocity, as I said. And they're restricted interests, very narrow. For example, they will only watch one TV show, like Thomas the Tank Engine, this child did. you know, and they have obsession. You know, if they're playing with a car, a normal child will just push it up and down, make little vroom, vroom, vroom sounds. But this child will throw it down and watch the wheels, almost like this repetitive movement. It almost kind of soothes them. These stereotypic, repetitive behaviors, pacing, rocking, rubbing a blanket. And parents often miss these symptoms. You know, it's very difficult from a parent's point of view, particularly if it's your only child. Who do you compare them to? And an interesting kind of problem is that obviously more boys than girls are affected. You know, almost a 3-to-1 more boys than girls, and it runs in families. And you know, there is a particular condition which is called Fragile X, and I know you probably haven't heard about it, but it is a problem called a trinucleotide repeat sequence, which can run in families. And it's one of the most common genetic causes of autistic spectrum. And I think that almost every single child who has autism with particular facial features, big forehead, jaw, narrow face, and they tend to sometimes mimic children with ADHD, and they can have a genetic test to exclude that. You know, the diagnosis and treatment, as I say, you've got to get the right doctor, someone who's really experienced. A generalist is not going to cut it. You've got to go to somebody who understands this, because the earlier we deal with this, the earlier we start it, we really can make a big difference. And a child with autism can be absolutely like having a child with a serious disability, can destroy your life, can be absolutely exhaust parents, can drive relationships apart in parents. It is something that's got to be really managed and supported. So this is just an introduction to help you understand that these are things that can be confused between ADHD and autism.